Here, to Mort's point, Democrats are feeling emboldened at least by some of the Obamacare enrollment numbers, even those in very tight races. Democratic Senator Mark Pryor of Arkansas says that he'd vote for the law all over again. Republican Congressman Tom Cotton is fighting for that seat. We did invite Senator Pryor to appear on this show. He wasn't available, but we might have him later this week. In the meantime, to the good congressman right now and what he makes of these latest developments, particularly the division among Democrats. What do you make of that?
Good afternoon, Neil. It's great to be on. I was frankly very surprised by Senator Pryor's comments last week that he would vote for Obamacare all over again. Obamacare is massively unpopular in Arkansas. Large majorities of both parties oppose Obamacare, just as they did 4 years ago when Senator Pryor cast the decisive vote for it. And it just goes to show that despite the double or even triple-digit increases that Arkansans are seeing in their premiums, or the loss of health insurance, or the loss of access to their doctor, Senator Pryor just still doesn't get it. He doesn't understand.
Well, he says that you don't get it,
Congressman.
He's saying you don't get it, and that if you endorse the conservative budget that is out there, the Paul Ryan budget, that would gradually lift the Medicare eligibility age to 70, you're going to do a whole lot more to hurt folks than he's doing now. You say what?
Neil, Senator Pryor has also endorsed in past increasing the eligibility age for Medicare and Social Security. More importantly, Obamacare rated Medicare $700 billion to pay for Obamacare. What we propose to do in the House is to modernize and reform Medicare so it's available not just for my generation, but for my parents' generation.
But you are for raising the age. You say he was for raising the age, so you say there isn't that much of a space between you.
We make no changes for those who are in or approaching retirement and eligible for Medicare. But for my generation, for people who are decades away, who are living longer than we ever have in America, then yes, we do need to modernize these programs to make sure that they can continue to fulfill the promises we've made to all Americans.
Congress, you know, Republicans have always been in a rock and a hard place when it comes to criticizing this law, when they say, all right, well, what would you do? Now, there are at least 4 viable Republican plans, particularly in the Senate, that Harry Reid has simply not taken up. But the one common theme in each and all is that they have tort reform, or, you know, this removing this pall of paying high legal fees on the part of doctors in the medical establishment. Would you compromise any of that to get any bill, any Republican measure forward? Because that seems to be a non-starter with Democrats.
Neil, in the House, we've passed numerous measures to try to protect our constituents from the harms of Obamacare. Just last week, we tried to lift the cap on the weekly work week from 30 hours, which Obamacare puts in, to up to 40 hours. We've tried to stop the individual mandate tax. You're right that there are lots of reforms, but they truly do all have in common is trying to empower patients so they can have the choice between insurance plans or doctors or other kind of providers, not bureaucrats in Washington in control. So in the long term, we do have to repeal Obamacare entirely, but ultimately we need to replace it with reforms that trust patients and doctors, not bureaucrats in Washington.
Congressman, thank you very, very much. By the way, on the same issue tonight at FBN, did